Hi, good evening. My name is Reena Saju, and I'm here to present information on asthma. So it's easy, understandable as to what is asthma, how it is caused, what treatments are available, and how you can prevent it. So today I'm going to talk about asthma. And what is asthma? Asthma is a respiratory condition marked by spasms in the bronchi of the lungs. Bronchi are small, tiny airways uh, that gets blocked and causing difficulty in breathing. It is also called a condition in which your airways narrow and swell and produce extra mucus. It makes it difficult to breathe and trigger coughing, wheezing, and shortness of breath. Asthma is generally reversible either spontaneously or with treatment. More than likely, it is with treatment that we see a response. Now, there are various causes for asthma. Some of the most common ones are allergies to the nature or pollen or whatever's there in the environment, smoking, exposure to chemicals when you work in labs or, as chemists, when you're exposed to different chemicals, paint job. These are the stuff that can trigger asthma. Being overweight is also a cause for asthma. And of course, family history also triggers asthma. So these are some of the common causes for asthma that we come across. Now, pathophysiology, or what happens to your body with asthma. Now, asthma is characterized by inflammation or swelling or edema, bronchoconstriction, where the airways are narrow, the smaller ones and the bigger ones, and then there is a lot of buildup of mucus or like we call phlegm in your airways, which leads to cough. And there is, your airway is narrow, so there is chest tightness, you feel wheezing, and also you're short of breath. So basically, you have a trigger factor. Let me get a pointer so it is easier. You have a trigger like an allergy or any kind of symptom that causes the asthma episode. And once your body is exposed to the trigger or you come in contact, then there is inflammation or slowly, the lining of your respiratory tract or your airways start getting inflamed. And that causes to hypersecretion of mucus or basically more phlegm that you cough and you spit out. Then it also causes your muscles to contract or constrict, making it difficult to air to passage. That makes it very difficult to breathe. And then swelling of the bronchial membranes, those are those tiny airways which are all over the lungs that help the air to travel. And all these three causes your narrowing of the breathing passage or the airway, which ultimately leads to all the symptoms such as wheezing, cough, shortness of breath, tightness in chest. These are all the asthma symptoms. So the next slide I'm going to show is actually how the airway will look. Now, I'm sorry I didn't get a better quality picture, but here you see how normally your airway is quite open. That's your normal airway when you don't have an asthmatic episode or you do not have asthma. This is how your airway looks. Now, this is the airway. You see how small the spaces become in comparison to the normal one. This is the airway when you are an asthmatic, when you have chronic asthma and you are on medications during all those asthmatic episodes. When you have a real asthmatic attack, like where you are so short of breath that you have to seek medical attention, you can't breathe, you feel restless, you're just gasping for air. This is how small the airway becomes in an acute attack. So you see how the airway narrows, making it very difficult for air to pass. That's how you feel short of breath. We can hear wheezes, and it's an asthmatic attack. So this is basically how the actual airways um, narrow down, showing how uh, the asthma episode can happen. And here you see how those inflammation or swelling is happening, and compared to here, you can see the difference, how much it is narrowed down. So that is the best way of know. That's a way normally your body would be in an asthmatic situation. Now, asthma is so common. It is, we see everybody, most of the people talking about how I have allergies and how I have difficulty breathing. Now, these is the census or statistics from the 2015 from the CDC website, that is Center for disease control. And you see, children ages 18 and less, we have 8.4% of our population who's currently asthmatic, and adults over 18 years, 7.6%. Now, if you look into this slide, this is a 2015 statistics on persons who actually report having one or more asthma attacks. And there is, if you look at the adult and the children, there is not much difference in the percentages of who has more or less. But you see the children under 18 are slightly higher, that is at 47.5%, who have got one or more asthma attacks in comparison to the adult, that is at 46.6%. This also impacts missed school days. And a study conducted in 2013 accounted for more than 13.8 million missed school days. That's a lot of school days for school children because you miss out on tests, important matters in the school, presentations, projects, and that really impacts your school life. So you can see how asthma can impact the young and the adult equally. Now, the treatment guidelines for asthma. Now, there are a few things when you are asthmatic and you are on asthma treatment that you need to remember. One of the most thing is that asthma often changes over time, and it's important that you work with your doctor to track your signs and symptoms and adjust the treatment or medication as you need it. So it's never like you get on one drug and you continue that for as long as you have asthma. Things change, and you and your doctor are the best people to come to a discussion on what is the best treatment. So your doctor has to be always in track of your signs and symptoms. Then the type of medication depends upon various factors such as age, the severity of the symptoms, the asthma triggers, what kind of situations are triggering the asthma, and what best keeps your asthma under control. From where there are many drugs available, not necessarily all of them will work for you. So we need to know what's the best drug that will help keep your asthma under control. Then it's also important to stay compliant with treatment for better control and outcome, because if your asthma is well controlled, you have a better quality of life. So that's why it is important that you stay compliant with treatment. Then if your symptoms worsen while you're on treatment, then you must call 911 or call your doctor depending upon how urgent or how severe the asthma episode is. So you have to always remember that who you need to call at what time, or what type of medical care that you need to seek when you have asthmatic symptoms or when your symptoms are just beginning. Now, going through the medications, when an asthma attack happens, you are so short of breath, you want a quick relief. You don't have time to wait and go for a long-term relief. So you have this quick relief rescue medications that normally is what when you get in an acute asthma attack. And you have the various categories are quick relief bronchodilators. What they do is they dilate or they open up the small airways, which are called bronchioles, and they act fast within minutes, within seconds to minutes, and it helps to control your asthma symptom. The commonly used products that you find around or in market are the Pro Air, Zopanex, Ventolin. That's the common brand names that you would find, and they are available in handheld nebulizers, handheld inhalers, or in nebulizer forms, or in breathing treatment. Nebulizers are breathing treatment where they have a mask over your face and you get all the fumes or the breathing treatment. And handheld inhalers are those little pump puffs which you normally see people carry around. Those are the ones, they are called the handheld ones. Then you have ipratropium or Atrovan. That's also generally a handheld inhaler, like a rescue inhaler. When your symptoms are really bad, when you go to hospitals or doctors' offices, they give you in the mask as well as a nebulizer. And they act very quickly and immediately relaxes your airways, making it easier to breathe. The side effects commonly are headache, dry mouth, hoarseness, cough, nausea, and dizziness. Now, corticosteroids or steroids are another group of medications that's also used for quick relief and rescue. They are in oral form or in IV, or they inject it to you through an intravenous line. Now, intravenous is more for the acute, and oral is when you have a symptom, it's controlled, but it's still in acute phase that you go into oral. Now, the most commonly used medications are the prednisone or methylprednisolone. They relieve the airway inflammation caused by severe asthma. The common side effects that you normally notice are weight gain because it causes fluid retention. some salt retention or sodium retention. So obviously you start swelling up, and also it increases appetite. So that all leads to gradual weight gain that you normally notice. Then the other things are that your skin can start thinning, and it is when you take steroids, it lowers your immune system, so you're open to developing acne, bruising easily, dry skin, you have a headache, dizziness, nausea. Those are the other symptoms. And when you have a pill form or the oral steroid medication, make sure you take it with a meal to prevent any kind of upset stomach, because it irritates your stomach. So you don't need that. You do not want to get that. So you need to make sure you eat something or take it with some food or immediately after food. Continuing on the treatment, along with the quick, that is for the immediate asthma attack, there is long-term asthma control medications that are highly recommended, because you need a long-term control, and they are the cornerstone of asthma treatment. And these medications keep asthma under control on a day-to-day basis and makes it less likely that you'll have an asthma attack. And when you have lesser asthma attack, the better your quality of living, the more activities you can get involved with. Now, the common medication groups are the inhaled steroids, and you might have the most commonly you will find is the Flonase and the Pulmicort. Flonase, you even find those nasal inhale, it's commonly found. Flonase is a name that you come across very commonly, and their basic role is they're anti-inflammatory. They help reduce the swelling so that your airways do not narrow down, and they're relatively at a low risk of side effect and are generally safe for long-term use. The common side effects that you would come across is headache, sore throat, sneezing, nausea, vomiting, white patches inside your mouth, because many of them are powder form. So when you take a puff, the powder remnants are there in your mouth, and when they stay there, it causes white patches, or thrush, some people call it. So to avoid that, you must make sure that you rinse your mouth to prevent such white patches from occurring. Then there is the leukotriene modifiers. These are fancy name for allergy medications. The most common one is the Singulair, and they are just allergy medication to help to prevent any allergens from triggering asthma, and they are for like a whole day control. They more normally help to control those allergy related issues for over 24 for about 24 hours at least, so that way you have a better day. Side effects are tremors, bruising, numbness, tingling, change in skin color. You'll find purple or red pinpoint spots on your skin, and at times it may even cause skin rash. Continuing on the long-acting asthma control medication, there are long-acting bronchodilators, or medically called beta agonist, and they continue to work for longer periods of time, 12 hours or more, and help to keep your airways open and preventing asthma symptoms. So that's a long-acting you need for longer coverage. Now, the only thing with this is it's long-acting. It acts at times. You may find that your asthma symptoms also worsen, but those are the times you can take the short acting and see if that will help you at that point, but you still need to be on those. The side effects are palpitation, chest pain, tremors, skin rash, bruising, worsening asthma symptoms, like I just and I explained. There are combination inhalers, and these are generally a combination of bronchodilators, which help to open up the airways, and steroids, which help to bring down the inflammation or the swelling. And the most common one you would see is Advair. It's a purple discus, like a purple, disc kind of medication. Generally, most of that's like a commonly used products. Now, the side effects for them are palpitation. You may feel fast or uneven heartbeat. Sometimes you'll feel restless. You'll have tremors, chest tightening, sometimes trouble breathing, white patches or sores inside your mouth. And the reason being is these are powder-based inhalers, and they will leave the remnants in your mouth. So it is advised to rinse your mouth every time you use it to prevent those settling down and creating thrush or just white patches. Then the last group is the theophylline group. They are oral tablets to keep the airway open. They are bronchodilators, but they are in pill form. They are not so commonly used as it was used few years back. Nowadays they're generally used when you have severe allergy symptoms that always or will trigger an allergy reaction or asthmatic episode, which is really a strong asthmatic episode, and it is more frequent. It's very rarely used, but it is used when your condition is really so bad. Most of the side effects, common side effects, are nausea, vomiting, headache, insomnia, or you don't, sleeplessness. You can happen that. One of the other problem with this medication is the blood levels have to be checked, because there is always a fear or always a possibility of toxicity. And when you are having high toxic levels, it can cause diarrhea, irritability, restlessness, and also fine tremors. So that's why this is not a very commonly used drug. This is more used when your symptoms, you have such bad allergies that a little allergy and you trigger an asthma symptoms. It's used in an extreme case at that point. Um, the other long-term treatment goals are allergy medications, and they help to keep your asthma in check, or if your asthma continues to worsen. These are very long-term goal, like a long-term approach. One of them is the allergy shots. They are taken over a period of time. It could be years of shots that you need to take before you see some relief. And they reduce your immune system, so they don't react that easily with the allergen. So they work on your immune system, lowering it down, so your body doesn't react so much um, um, with the allergies. But then, the major side effect is when your immune system is low, you're prone to catch um, other infections and so forth. So that's a very long-term goal. Then one of the other drugs is the Xolair. That's an injection which is given for 2 to 4 weeks for people who have allergies and severe asthma because of allergies. Those are not a common recommendation. They are case by case. It depends upon how strong it is, what's going on, and so forth. So those are the very long-term goals. Now, prevention is always important, and that is one of the best ways to keep your asthma in check. And the most important, or the best way, is to have your own asthma management plan, because when you have asthma, you know what triggers your allergies, you know what your symptoms are, how your asthma begins. So you can have your own personalized asthma management plan, and you and your doctor can create it. So generally it's created by you, because you know what your body is going through, you know when what happens, and your doctor. So that way there is a plan, if for a situation, what you need to do. This way it will help you to control the asthma, not the asthma controlling you. Now, some of the key factors to preventive measures are: know your asthma triggers and minimize contact with them. So you need to observe and identify what causes your asthma or what makes your asthma worse. For example, you notice that every time you vacuum, you get an asthma episode. Every time you work in your lab for your chemistry class and you notice that your asthma triggers. Um, you go out to a park or places and you notice your asthma triggers. So you just have to find, are you close, when you're close with your pets, is that the time asthma triggers? So you need to keep an eye and observe it, because that'll help you, one, identify what's causing your asthma. That way you will stay away from those triggers as much as possible. It's not possible to stay away from everything, but as much as possible you'll stay away from it. And then you'll have to let your doctor know. So if there are any prescribed medications, any specific drugs, any specific methods that can be used or implemented as needed, that will help as well. So you need to know what's causing your asthma and minimize contact with them, but let your doctors know so they can help you. Like, for example, some asthmatics, their asthma get triggered right before an exercise or right after an exercise. So those are the times the doctors can give them, can prescribe to take the short-acting rescue, so you can get your exercises done or participate in a sport. So that's one of the examples why you need to let the doctor know. Then take your asthma medications as prescribed, because treatment compliance, or being on top of your treatment regimen, is important to keep your asthma in check and not let them give you frequent asthma attacks. Then the most challenging thing for most of the asthmatic is those inhalers, and generally the handheld inhalers, because there is a technique how you need to take those puff. you have to learn the right technique, otherwise they will not work well, because you don't use the right technique, you are not going to get the maximum benefit of it. These medication has to go all the way into your airways in that area. So if you don't inhale well, if you don't seal your mouth around the mouthpiece, then you do not have the good technique. And when you do not have good technique, no matter how much you take, you won't find the optimum effect. So the best thing is you need to learn the good technique. You need to let your doctor know, you need to know it well. They'll have nurses who are trained to teach you how to do it. There are videos that demonstrate how to do it. So that way you learn the first time the right way to take it, and that helps a lot. Now, the other preventive measures are track your asthma way early, recognize those worsening signs. Because asthma episodes never occur without a warning. Normally, you will feel like you're coughing more. You feel like, when you walk or do a certain activity, you're kind of getting short of breath. So your body starts telling you stuff. So you need to be well attuned to your body or know what it's telling you. Because one other thing with asthma is that the airways narrow quite slowly, and you may not feel those symptoms really bad unless and until they're badly narrowed or blocked. Then key to controlling asthma is take your medication at the earliest possible sign of worsening. The moment you know, hey, this is my asthma, it is 1 hour ago what I was, it's not the same. Take your medication. Don't wait till it gets worse. The faster you take, the better control you have. The most important to know what to do when your asthma is getting worse or you're in an acute asthma attack, because they can be fatal. So you need to, if you follow your asthma management plan, generally you are way ahead on top of your game, and you know what to do when. And depending on the severity, you have to know at what severity level do you call 911, or you just go to the nearest ER, or just call the doctor's office. So that's something your doctor will discuss, or you come to a plan depending upon how your symptoms are, what you feel, and what's going on. So these are all that can be done with the asthma management plan that helps prevent asthma attacks or make them less frequent. Then all these treatments, everybody wants to know how effective they are. The best way to monitor effectiveness is treatment compliance. Follow your treatment plan as they are prescribed, because if you follow them, you have better chances of controlling them, less frequent asthma attacks, and you can have a better quality of life, or participate in more activities, be as normal as you can. Regular follow-ups with your doctor is important, because they need to monitor, manage, and make sure everything is on track. You have the medications you need. If they need to change the dosing, medications, other factors that may affect you, they need to keep a close watch on that. So you need to have regular follow-ups. And identifying early symptoms. Don't wait till your symptoms are too bad. As soon as you realize that these symptoms are worsening, start your management plan. The best way to tackle asthma is like a life-altering condition. It changes your lifestyle, and your lifestyle has to have proper asthma management plans in place, because you want to have a better quality of life and get more out of all the activities, whatever you can participate, and be at the very optimum enjoying your life, and not having to be confined or controlled because of your asthma symptoms. So you need to be on top of your game, and you are the one who can control the asthma. It's in your hands. The better you keep an eye on it, the better ready you are about it, the better well managed they are. Make sure your treatment compliance, you're regular with follow-up, and identify early signs and symptoms of asthma attack. So this is basically on what is asthma, what changes your body undergoes when they are in a severe asthma attack, what treatments are generally available and prescribed, and how you can have a well-developed asthma management plan for prevention and better management. So the impact on your health and your overall quality of life is less, and you have a positive lifestyle, or more active or lifestyle. So, and for any questions, concerns, make sure you call your physician and talk to them. No question is unwanted, unnecessary, or stupid. It's everything is important. You have a slightest doubt, make sure you discuss it with your treating physician, and so they are aware, and you have all your questions answered, and you can have a better life with asthma. Well, thank you and have a nice day. If you have any questions, please let me know.